Good afternoon, ladies and gentlemen. Welcome on behalf of Robert Wood Johnson University Hospital, Somerset, to this afternoon's webinar, Breathe Easier, the Effects and Implications of Recreational and Secondhand Smoke. November is Lung Cancer Awareness Month, and many individuals struggle with smoking and smoking cessation. During this webinar, you will understand the effects of smoking on your overall health, types of smoking and tobacco use, including vaping and chewing tobacco, the differences between legal and recreational use, the effects and implications of legalized marijuana, the various diseases smoking causes, the impact of secondhand inhalation, signs and symptoms, diagnostic tools, including the lung cancer screening program, and cessation strategies. Joining us today are Dr. Ishan Patel, a board-certified medical oncologist on staff at RWJ Somerset, Caitlin Ricardo, manager of the lung cancer screening program, and Cynthia Kinsella, a tobacco liaison with the nicotine and tobacco recovery program. Without further ado, it is my pleasure to introduce Dr. Ishan Patel. Dr. Patel?
All right. Good afternoon, everyone. We're going to talk about today regarding the effects and implication of inhalation, and that can be from smoking cigarettes to marijuana, not only recreational inhalation injuries, but also secondhand exposure, right? So a lot of patients who have not smoked, but they have been exposed to some family member, or due to the nature of their work, they have been exposed to secondhand inhalation. We're going to talk about them as well. So what's the impact of smoking and tobacco use on health? It has a various impacts, and we're going to talk about what are certain diseases that can cause by smoking, some prevention strategies, and also comprehensive presentation today in a lung cancer screening, who are eligible, what it entails, how often you should get a check for lung cancer screening. And we're going to talk about different tobacco types and legalization of marijuana, what that has effect on our society now. So tobacco use, smoking, inhalation, nowadays there are many different products out there. So even after so many years of going through a lot of diseases and prevention, we still have 27.1% of people in United States using some form of tobacco product. What has changed in last 5 to 10 years is, instead of smoking, now is more e-cigarettes. So instead of cigarettes, people are using more e-cigarettes, and this is very popular for our youth and younger generation. So it's very worrisome because we do not know long-term impact. It might not cause certain cancer, but it still can cause cardiovascular disease, and also still cause very acute lung injuries. We have seen, and personally, I have seen patients admitted in ICU in their early 20s because of vaping causing severe lung injuries. So smoking still remains the top preventable cause of disease and death in United States and worldwide. It affects individual, families, society, significant health and economic consequences. We're going to talk about secondhand smoking also today. So now there is more literature available for patients who have exposed to secondhand smoking, industrial smoking, diesel fumes, a lot of those secondhand inhalation also has showed impact on their health and showed increased incidence of lung cancers. So cigarettes is the most common way of using tobacco. It contains over 7,000 harmful chemicals. Cigars and pipe, least common, but still people out there who have been using cigars and pipe, and those usually cause high risk of mouth and throat cancer because of that direct there is no filter, so there is like a direct injury to all the healthy tissue. Chewing tobacco, unfortunately, we have seen young patients, they're either lower socioeconomic class or they are from other countries, immigrants, where in Asia is very popular to chew tobacco. So given that we have such a diverse community and we see a lot of those patients at the young age having increased risk of oral and esophageal cancer. Vaping e-cigarettes, the use is going higher and higher in our teenage and early 20s youth. Or it does not have that long-term effect right now reported because it's very new that everybody started utilizing it. Is it safer than cigarettes? We are not sure right now, but it still contains nicotine, right? And other harmful chemicals. So eventually, we will know in few years, the data will be out there. But what we have seen acutely in last 5 years, that's still very worrisome. Vaping contains fewer, just people to understand the difference. Vaping, a lot of people think vaping is very safe, and as I said, in like Europe and other countries, everybody think that vaping will not cause cancer and they have moved towards vaping. But it's true, it contains fewer chemicals than traditional cigarettes, but still there is a nicotine addiction concern. There is a link to lung injury, as I was saying, that it causes very acute lung inflammation, lung injury. At times, patients are presenting to ICUs and have oxygen dependence. So it's very uh, harmful to our healthy lung, and within few years we have seen those kind of impacts. So I think that's very worrisome, right? Cigarettes has caused that over a long term, but vaping has shown those kind of inflammation you within like 2-3 years of use. I don't think so it makes that any better. Smoking, long-term exposure to tar and carcinogen, that what really makes it more harmful. High prevalence of chronic diseases like coronary like lung cancers and also COPD. It causes lung cancer, other respiratory issues such as emphysema. It also causes cardiovascular diseases, neurological diseases, such as it increases the risk of atherosclerosis and stroke as well. Chewing tobacco, besides due to direct contact, having carcinogen, causing head and neck and esophageal cancer. Besides that, is also very injurious to oral health, causes the gum recession, leukoplakia, lot of other gum related diseases. Systemic effect, again, nicotine addiction, and leads to cardiovascular issues. It leads to increase in the plaque build in your heart and in your anywhere in the any vessels of your body, putting you at a very high risk of peripheral arterial disease, strokes, and heart attacks. So it reduces life expectancy. It has organ damage. It can cause your heart damage, lung damages. It has long-term effects, right? So COPD patient, their quality of life is very poor, oxygen dependence. It weakens the immune system, which prone you to get increased infection and respiratory issue. I think we talked about the cardiovascular issue that includes heart attack and stroke. Cancers, and from there is a lot of cancers that are associated, of course, lung cancer, but head and neck cancer, bladder cancer, that has also associated with smoking, heart diseases, that also includes heart failure, respiratory infections, and weakened reproductive issues even at times. People who are smoking have hard time having they have more reproductive issues. Childbearing becomes a problem for a lot of those women who have smoke, and erectile dysfunction is a major concern for young males who smoke. So also reproductive issues. There is also strong relationship between e-cigarettes, vaping, and psychological issue. It has been linked to higher rate of depression, anxiety, and stress. And it's that vicious cycle, it's like they vape and use of e-cigarettes because they are stressed, but then that leads to whenever they have that less nicotine in their body, and then they need more nicotine, so it's nicotine dependence. That's how they get addicted to it. So vaping has been a problem because it has nicotine salts, which cause the addiction. Besides that, the vaping, the way the e-cigarettes are made, it also has a propylene glycol in it, which worsen the lung function and makes it harder to breathe. It can cause stiffness of a lot of those lung vessels. Flavoring chemicals, those are also very toxic. This is has seen now in schools. 14.7% of Wisconsin high schoolers admit of vaping, and this was numbers from like 2022. So it's very alarming, and those numbers are growing everywhere. So those young kids are getting nicotine dependence, and the long-term effect of this vaping is just very, very deleterious to their health. Secondhand smoke, who is affected? Those are non-smoker, especially children and pregnant women. Patients, oftentimes they have diagnosed with lung cancer, and they have mentioned how they raised in the family where their parents were smoker and they had long-term secondhand smoking exposure. uh, Certain people who had worked in 80s and 90s at places where smoking was allowed inside the building, and they have been exposed to multiple secondhand smoking. Pregnant women, that can also have a major impact, secondhand smoking, on the in uterine baby. So I think very important not to have secondhand smoking around pregnant women. Um, what are the health risks? More and more data is showing that those patients are also increased risk of cancer. Probably not as high as a direct consumer, but still compared to the normal population who do not have any exposure, secondhand smoking definitely puts you at higher risk, 3 to 5 fold high risk. That also puts you high risk of having more infections such as pneumonia and upper respiratory tract infection, also developed asthma and more reactive airway issues for later life. Infant health, it has increased risk of sudden infant death syndrome. So those are the pregnant women who are exposed to secondhand smoking. Their babies are have a high risk of premature deliveries or sudden infant death syndrome. So this is very um, uh, increased premature birth, and for infant it has caused sudden infant death syndrome. So again, very, very highly around kids and pregnant women to avoid secondhand smoking. Significant contributor to preventable disease worldwide, also the secondhand smoking. So I think if one person stops, they do not only beneficial to their health, but beneficial to health of their family, and in general, I think to the community. Going towards marijuana, legal versus recreational use, right? So it's legalized now in the state of New Jersey. Before it was legal use for as a medicine, medical marijuana to treat pain, anxiety, nausea, epilepsy. Um, I for cancer patient, I think it has been a very good in terms of controlling their nausea, pain, anxiety, and they have been relying on marijuana to control their stress level, require less pain medications such as opioids. So it has been great use in that regards, but recreational use, I think we still need to learn about long-term effect after uh, legalizing it. So there is a poses the risk of misuse and abuse, right? Dependence. I think those are highly, highly challenging right now. Also endocrine problems. So patients who have used marijuana daily for many years do get a lot of issues with their hormonal imbalance. So there is also literature on that. So this is something, how great of effect it will do over long term, only time will tell, but I think it has definitely potential of mental and physical health problems if you use recreationally very often and have abuse or dependence on it. Medical benefit, as I said, as an oncologist, treating a lot of cancer patient, definitely for stage 4 patients who has mets to their bones is very helpful to relieve the pain, nausea. It helps them in a lot of different aspects, also their appetite and gaining their weight back. So definitely great in that regards. Smoking marijuana, I think, is still a great physical risk by damaging your lung. So again, I will advise not to smoke. Even all the patients, cancer patients, we advise them either go have edibles or either liquid, which is more safer than smoking, because with the smoking you do not know what is mixed in it, and smoking still causes the damage from the inhalation. Also it can cause potential cognitive impairment, so those are great physical risk. Social concerns, just addiction is the problem, and the secondhand marijuana smoke probably also have some cognitive issues. And also if you're around somebody who's smoking marijuana, how much damage it does to the lung. The data is not there, but eventually we will also know about damages from secondhand marijuana smoking. But again, still, I will attribute marijuana for medical use, but recreational use still has a lot of health impacts, and we should be very careful. So what are some signs and symptoms of tobacco-related diseases? For lung cancer, COPD is usually cough, chest pain, shortness of breath, wheezing. Those are some common symptoms. For oral cancer, it's usually ulcer. It starts with the ulcer, difficulty chewing, mouth sores that not getting better, difficulty swallowing. Heart disease, usually heart attacks start with the chest discomfort, palpitations, any exertion, it causes some chest discomfort. Those are primary indicators. How do you diagnose each one? For lung cancers or COPD, it usually, lung cancers are by the images, so usually picked up on the CAT scan or chest x-rays. COPD is usually clinical, and they do some testing on the pulmonary function, how well your lungs are functioning, and they can make the diagnosis. Oral cancers are mostly ulcer or something that your dentists pick up most of the time, or the ulcer starts growing and causing pain, and we do visual ENT doctors who does direct visual examination and biopsy to diagnose it. Heart disease, of course, EKG depends on the what kind of disease. MI is usually by EKGs, and if it's heart failure, it's usually checked by the echocardiogram. Just by quitting smoking, that's the biggest healthiest thing you can do, and we always say that, and I think when our prevention institution person will talk about it, they will agree with me. And we tell this to patients, the biggest thing you can do to yourself for your health is quit smoking. Immediate benefit is heart rate normalized within minutes, because the carbon monoxide level drops within hours. 1 year later, the risk of heart disease and stroke significantly reduced just by after stopping it for 1 year. And 10 years later, the risk of lung cancer drops by 50% of quitting for a decade. So I think that's the best thing, as I said, you can do for your health. And I will advise everybody to stop smoking. We have a great prevention program, and I think Cindy will go over it. But there are different ways to quit, and there are behavioral therapies, medication available to help you quit, or your loved one who you want to quit, because as a secondhand smoking is still a major concern. All right, that's it for me. I think Caitlin can take over, and she will present lung cancer screening, who are eligible for lung cancer screening, and what are some modalities.
Thank you, everybody, for coming. So this is our program presentation about the lung cancer screening program here at Robert Wood Johnson. So lung cancer screening, it is a CAT scan of the chest with minimal radiation in comparison to a standard CAT scan. We do it right here at the hospital outpatient. We obtain a prescription from your provider and we get you scheduled in radiology. There's no pre-op testing involved. There's no contrast. There's no blood work involved. There's no, like I said, no pre-admission testing that's required for this test. So with lung cancer screening, there is very specific criteria in order for an individual to get scheduled and as well as their insurance to cover it. So some of the eligibility and criteria for the lung cancer screening is age range started at 50 up to 80 years old. Medicare does cover this up until age 77. And commercial and private insurances will cover it up to age 80 as long as the remaining criteria is still being met. Patients must be a current smoker or a former smoker, and former smokers had to have quit within the last 15 years. And then patients also have to have what's called a pack year history, and it's a minimum of at least 20 pack years. So an example would be about a pack a day for over 20 years. And the patients must be in overall good general physical and mental health. So patients can't currently be undergoing treatment for another cancer diagnosis. We want to make sure that they have the mental and emotional capacity to prepare for this, that they are prepared. It is a screening exam, so we want to make sure that they are readily prepared for results that could potentially come, and we want to make sure that we let them know that we're here to support them and that we'll navigate them through this process. So a typical journey of a lung cancer screening patient, a negative screening would be no nodules, no other abnormalities seen, no presence of lung disease, there's no other asthma, COPD present, and the patient would return for an annual lung screening. A positive screening and determinant of cancer would be a nodule or multiple nodules identified. And about 50% of patients have one or more present nodules, and they're typically not cancer. We would take a deeper look into those just to make sure the characteristics of these present nodules aren't suspicious or concerning. And the patient, again, would also return for an annual lung screening. And a positive screening that would potentially be suspicious for lung cancer is suspicious nodules or masses that are identified that could require further testing. And further testing could look like another CAT scan, low-dose CT in 3 to 6 months. It could also be a PET scan or potentially a biopsy. And at that point, we would refer a patient to see our thoracic surgeon, have a consult with them, and see what the best route for them at this time would be. Some of the benefits of the lung cancer screening, it's utilized for early detection of lung cancer and other various diseases. So that's our whole goal with lung cancer screening. Early detection is so important. We don't want any lung cancers to get to later stages. We want early intervention for treatment because an early intervention is curative. Screenings are beneficial as they can detect cancer prior to a patient becoming symptomatic. Unfortunately, with lung cancer, patients necessarily aren't symptomatic until the cancer is in later stages. So again, that early detection is super important. Mortality rates of lung cancer are decreased when patients are compliant with their yearly screenings. Again, it just ties into that early detection. When patients are compliant and return for their routine annual screenings, we have better outcomes for them. And patients who are current smokers are more likely to quit when they are enrolled in an annual screening program. Again, we assist with the navigation and we have a team here to support them. And some brief information on how to schedule. You can reach our main phone number, the 855-795-5864. You can also contact me directly at the numbers listed either through phone or fax. And we also have it listed on our Robert Wood website to request an appointment.
Hi, everyone. My name is Cindy Kinsella. I'm the tobacco liaison for RWJBarnabas Health Nicotine and Tobacco Recovery Program. So we have an 8-week treatment program. We provide the patch, the gum, and the lozenge free of charge, mailed to anyone who enrolls after they're assessed and enrolled. We are open to any resident of New Jersey with a nicotine or tobacco addiction of any age. If the patient would like to use one of the other medications, the Zyban, the Chantix, the The nasal spray or the inhaler, we have a provider, Dr. Michael Steinberg, that we work with, and he can write it as a script. Right now, the Nicotrol inhaler is discontinued, but it is still approved and patients are still able to find it. We use an evidence-based treatment program over 8 weeks. Our counselors schedule appointments with the patients and they go over triggers, the quit date, stress management, weight management, relapse prevention, and then there is a graduation date. Counseling is easy. We have phone one-on-one, we are HIPAA compliant Zoom and group one-on-one counselings, and in-person locations. We have 6 tobacco treatment specialists that cover Mercer, Middlesex, Monmouth, Essex, Ocean, and Union. So if a patient would like to go in person, they do have office hours in those counties. Referring is easy. Internal referrals for providers and non-providers are via Epic. Individuals can self-refer by going to the landing page and filling out a form or calling us on our quit line. For offices and practices that are not on Epic, we have a referral form. They can email us right to the quit center. We have a Spanish-speaking group and an 8-week treatments program led by our Spanish-speaking counselors. There is also an LGBTQ+ group out of Inspira, and Inspira also has a virtual youth group on Monday nights. We also run a nicotine and tobacco recovery group. It's a virtual support group. It meets on Monday nights from 7 to 7:45, and our tobacco treatment specialists run this. They educate and support patients, and it's open to anyone with a nicotine and tobacco addiction who is in recovery or just starting their journey. So we know that with support and with NRTs, that makes it the patient's chances really increase to quit smoking. And New Jersey has quite a few resources, and we are available to all New Jersey residents of any age. Thank you, and that is it for me.
Well, thank you all very much for a very informative presentation. I'm sorry I couldn't get you hooked up fast enough, Cindy, but I appreciate you sharing some fantastic information. This will actually conclude our webinar. Should you have any questions or need additional information, please visit our website, www.rwjbh.org/Somerset. Should you need a physician, you can also visit the website or call 1-888-723-7124. On behalf of Robert Wood Johnson University Hospital, Somerset, we'd like to thank you all for joining our webinar this afternoon, and have a great rest of your day. Take care, everyone.